and we are just going to hand it over to Minot and let her get us started. We're about at 12:02, so we're going to go ahead and get started.
Perfect. Thank you, Latrice. And just to confirm, can everyone see my screen okay?
Yes, ma'am.
Yes.
Fantastic. All right, well, let's go ahead and jump in. My name is Minot New. I support the relationship between IQVIA and Embold Health, and just wanted to take some time today to share with you what we do for IQVIA, the successes in our partnership so far, as well as some updates and enhancements that are coming out for you all in the very near future. We'll definitely save time for questions as well, so we'll just jump right in. At Embold Health, we help to connect people to high quality doctors. We rate doctors' performance on what matters the most, really the effectiveness and the appropriateness of the care that they provide. And so we provide those quality ratings in IQVIA's provider guide. That's your directory that is full of in-network doctors. And IQVIA has an amazing benefit where the copay for an office visit is waived for those top quality docs. So those providers are flagged with a blue badge. We'll get into those examples here very shortly. But first, just wanted to share with you some more detail on the importance of the quality measure, and why we are doing this for IQVIA. We certainly know the healthcare system is complex. We know there are a ton of resources out there, and it can be hard to know where to go for what information, what is reliable. And so that's why it is our goal to really eliminate the guesswork in finding a good doctor. We equip IQVIA members with the information that you need to make better healthcare decisions and select better doctors. Across our book of business, so across the various clients that we support, we have found that members that are using our provider guide, our search tool, are 40% more likely to select a good doctor and avoid the bad doctor. And so that means that inappropriate, ineffective, costly care is avoided. So it's time, it's cost savings back to you as the patient, and it's savings back to the overall health plan as well. So it's really a win-win. Just to give you a little bit more insight to that as well, when you have that relationship with a top quality doctor as opposed to a lower quality doctor, the care that you receive is more appropriate, it's more effective. So for example, a top quality ortho specialist is 54% less likely to prescribe opioids for brand new joint pain, whereas a lower quality spine surgeon is 154% more likely to perform surgery as a first pass, as opposed to trying any other type of physical therapy or less invasive treatment first. Certainly an unnecessary spine surgery is costly, the recovery time is significant. And so really we want to help you get connected to those top quality doctors so that you can avoid any unnecessary care and really just make sure that you're getting top quality treatment. Now, Embold Health was founded by doctors. Our leadership is made up of physicians. So the measures that we use to rate doctors, they're reliable, they are peer reviewed. We are completely independent, so we are not a network of doctors. Rather, we evaluate the doctors that are in your specific IQVIA network, and we rate them based on the quality care that they provide. So our results are not influenced by anything other than the performance of the doctor. We have been a brand partner of IQVIA's for a couple of years now, and we've had fantastic results throughout that time. Year over year, more and more IQVIA members are using Provider Guide to find top quality doctors. We've seen our engagement with your peers grow significantly. We've also expanded access during our partnership. So we are evaluating or measuring the performance of over 31,000 in-network doctors that are covered by your plan. And again, those top quality doctors are really served up to you then with that $0 copay. So as you form relationships with those top quality doctors, it's really driving savings to you as well as to the overall health plan. Do a quick look at some of the key features in IQVIA's provider guide so that you're getting the most of the tool and really to make sure that you're equipped to make the best healthcare decisions for you, your family, and your specific healthcare journey. So when you enter Provider Guide, either by going directly to icuba.emboldhealth.com or by clicking on the Embold link within iHub, this is the page that you'll land on. You can search for doctors by the type of care you need, by facility, by doctor name, so just to name a few options there. We typically see the top searches across IQUBA members be things like primary care doctors, dermatologists, pediatricians, as well as ortho joint specialists. But we have about 70 different specialties and clinical focus areas, so you can really dive in depending on
Hey,
what type of care you need.
folks, could I?
I mentioned the top quality doctors that have the $0 copay badge. So you can see these doctors and have your copay waived. But sometimes doctors' offices cannot keep up with the benefits of every single patient they see. Certainly that is
Hey,
a lot
folks,
to manage.
could we ask you to mute your? Sorry, I was getting some background noise. I thought there was somebody unmuted. My apologies.
Perfect. You're good. No, thank you. All right. So if you do ever go to the doctor's office and you know that you are seeing a $0 copay doctor, but the front desk is still trying to collect copay, this is a screen that you can share with them. We've titled it the healthcare provider information. So if you just click on the drop down there, you can either print this ahead of your appointment or you can show it to the front desk staff on your phone. But really, it's a way for you to share with them. It's an explanation of that $0 copay benefit. It provides the Blue Cross Blue Shield customer service number. So if they want to talk to somebody live to verify the benefit, just a little bit of extra information so we can make sure that you're not having to have that copay collected upfront. The other update I wanted to share with you is some updates to the badging. So I mentioned earlier that blue $0 copay flag. So when you log into Provider Guide, you will see this pop up here that highlights the badge, just to make sure that we're calling your attention to those blue badges, those $0 copay doctors. You can see here in this example, this cardiologist has that $0 copay badge. Again, that means your copay is waived because that doctor meets the quality standards to be considered top quality or high quality. Alternatively, on the right-hand side, if the doctor doesn't meet those requirements, they'll have this kind of red-orange badge next to their name. And that reminds you that, yes, they are still in network, but you will need to pay a copay because they're not meeting that top quality ranking. Just trying to make it a little easier to differentiate between your options there. There are a handful of other updates that are in the works to make Provider Guide just work even more seamlessly for you. We are working on a custom video that demos the site for you. So just something handy to have when you do have a healthcare need and need to remember what resources you have available. We're also working on a single sign-on from My Health Toolkit. So you really just have one place to go for everything you need. You'll be able to access Provider Guide straight from My Health Toolkit. Again, just kind of one less link to remember. We are always taking feedback on updates that could make the site more user-friendly. And your IQUBA peers have been really helpful in sharing some great insights. And so soon, a lot of that is being applied to some updates we're making to our search bar to make finding care just even more user-friendly. And then last but not least, there will be some updates coming April 1st to which providers are eligible for that $0 copay. So I do want to walk through that with you all just so you're well equipped for the new plan year. Each year, we go back and review the prior year data to look for any major changes in the doctors that are $0 copay. So it's really important to us that we uphold our commitment to IQUBA to serve up the most relevant, up-to-date quality information. And so there are some providers who maybe over the last year have left the network, or they're no longer practicing or seeing patients, or maybe they have had a meaningful shift in quality, for better or worse. And so those doctors For most of those reasons would fall off of that $0 copay list for the upcoming plan year on April 1st. If you have had a visit with one of the doctors that will no longer be $0 copay, you will be notified by mail this month. And those doctors are also going to be labeled as such in provider guide. So there's a little warning flag on those doctors that will be losing that copay benefit come April 1st. It is a small list, but just something you'll want to check for as you're making your healthcare and benefit decisions for April 1. Rest assured, though, we have a very extensive list of $0 copay doctors, regardless of where you're located, what specialty you need. We've made a lot of enhancements to how we curate that list to really make sure that you've got strong access, regardless of location or need. With that, I know I just shared a lot of information with you all. If there are any questions that I can support, I am more than happy to help. So I will pause my talking for a bit here and see if there's anything that I can dig into further for you.
Hi, Mano. There was one question in the chat that I didn't get a chance to answer, where somebody mentioned that they had recently seen a provider and they had the issue with the $0 copay and who they could contact for more information.
Perfect. Thank you. Yes. So if you have experienced that in the past, or if you encounter this in the future, one, certainly hoping that this additional information helps to avoid those issues in the future. But two, if you have come across that issue where a copay was collected inappropriately, if you can contact your Blue Cross customer service team, they'll be able to help walk you through that. And the Embold and the Blue Cross team work together in the background as well, so that we can provide some education to those provider offices too, so that it doesn't happen again.
How do we log on to Embolden to find the list?
So you can either access through iHub. There is an Embold Health link there that will come straight to your provider guide, or you can go to icuba.emboldhealth.com, and I'll drop that link in the chat as well.
I have just put it in the chat.
Perfect. Thank you, Josh.
And question in the chat on how to find the Embold providers. If you're clicking on that link, you're going to search the providers that are in your zip code. You'll see which ones are designated with the $0 copay from Embold, and which ones have the usual and customary copay required. But here you'll be able to enter, a location. You'll be able to narrow down by provider name if you're searching for a specific facility, and then you can refine your search further once you get into the search details. Don't see any more. I don't see any more questions in the chat.
Okay. Well, you guys will have this deck handy, and certainly you know where to find me if anything else does come up. I am always the type to think of my questions after I hang up, so certainly happy to support anything that comes up after we end the webinar.
For sure. Let's see. Just going through really quickly. And I can probably share my screen and go through an actual provider search. Here we go. Why do we, question in the chat, why do we see a doctor that is not $0 copay? Is that the question, Susan? Okay, so the question in the chat, I believe, is why would a doctor not be $0 copay? Some of the doctors that are in the Blue Cross Blue Shield network are designated as what are called total care doctors. So they have a special designation from Blue Cross Blue Shield that would give you a $0 copay. In addition to those providers, there are providers that have been identified by Embold Health as high-performing providers. These doctors meet the best outcomes, they're highly rated, and these doctors would also be designated as no copay. But any other doctors that you see within the network, you're going to pay the usual and customary copay for those visits.
I'll just add, Josh, too. So any of the doctors listed in IQVIA's provider guide are in network with Blue Cross Blue Shield. They just, as Josh mentioned, there are some that will be flagged with that $0 copay, that blue badge. So those ones are the top quality doctors within the network.
Absolutely. And the access to this is in when you're in the My Health Toolkit search tool, you're going to see the Embold Health designation. This is a special search tool that's separate for you to get additional information. You can find out, more information about the provider, get a specific ranking, stuff like that. So the My Health Toolkit is your normal search tool. If you're just logged into the portal, this is a separate search tool. And I will share my screen very quickly and just give everyone like a live walkthrough on the search tool. And again, the search tool address is posted in the chat here. It's icuba.emboldhealth.com. And when you log into that website, when you see my screen here in a moment, you'll see exactly what I'm talking about. When you hit that page for the first time, you're going to have the welcome screen. Welcome to the provider guide. You're going to agree to the privacy statement, terms of use. You can also click on screen to find more information about the methodology behind Embold Health's designations. You click continue. You're going to be reminded about the $0 copay flag for the Embold Health providers. Just a reminder, this doctor is in your existing network of Blue Cross Blue Shield providers, and that Embold Health isn't a provider network. They are just providing quality metrics for these doctors, and when they're identified as high performing, your copay is waived for those visits. You click OK, and then this is where we'll search directly for a provider. So if I want to find in West Palm Beach, doctor by specialty, name, MPI by place, then I can do that. I click on specialty. If I want to find ortho and joint doctor in West Palm Beach, select that option, click search, and I'm going to be presented with the options for the $0 copay providers first, but then I can refine this search however I'd like to. I can filter my results up here and sort by best match, distance, etc. So the best match has those $0 copay providers highlighted at the top. You search by distance. And when I do that, you'll see that there's a doctor really close to me, but the copay is required for that provider, i.e. the orange box there, the orange flag. And then Brian Leo, who's the second closest, is a $0 copay provider. And then you have here another provider again with the usual and customary copay required. So by sorting these by distance, you might see some providers where the copay is required right off the bat. By best match, you're going to see the providers with the $0 copay highlighted first, but they could be a little farther from your area.
One thing I'll add, Josh, that's very helpful with the filters, or you can see even without filtering, is whether or not doctors are accepting new patients. So just kind of one less phone call or research point to go through. You know, some patient rosters are full, and so if you want to kind of filter out those options to make sure that you are able to get an appointment sooner rather than later, you're able to do so.
So you can add filters, $0 copay, pick distance, gender, languages spoken, even hospital affiliations. To Mano's point, you can show or hide as many features that you might want to. So $0 copays. I'll say male provider. For fun, let's just try Portuguese. See what comes up. Two results in my area that speak Portuguese, and they're both $0 copay providers. So you can definitely finesse the results within the filters and in the sort tool. And as Mano mentioned, you'll see right on the tile for the provider that they're accepting patients. And you'll forgive me if there are any questions in the chat, but I have a hard time walking and chewing bubblegum at the same time. So I will just take a quick break and check the chat to see if there are any questions. There is a question about specialists in the Embold network and not seeing allergists in the area. So there aren't all of the specialists. All of the provider types are not listed in the Embold Health Network. You'll see all the specialties that are, and Mano, are these all of the specialties that are covered, or are these just all of the specialties that are within
These are all of the
guide?
specialties that are currently in provider guides. So there are more specialties being added come April 1. So this will be a little bit more of an extensive list. Now, just because there is a specialty, listed that we measure on doesn't mean though that those providers meet the top quality requirements to get that $0 copay. So perfect example with the allergists there. But remember, there will be updates to who is a $0 copay provider for April 1st. And so that was one of the things we looked at was, regardless of location or the type of specialty you need, we want to make sure that there is ample access to those $0 specialists. So I would recommend that you check again if there is a need that you're not seeing today that is $0 copay for the new plan year, and hopefully that if there's a certain provider you're looking for that they are now $0 copay. And if not, providers, this is a kind of a two-way relationship, right? We want to make sure that the quality of care that is available is always being enhanced. So providers also work with us, if they want to request their report on what makes them kind of measure the way they're measured, they can absolutely do so they can see where they improve too.
I'm just scrolling to see if there were any more questions while I was talking. I don't think that I see. Of course, I could be missing something. But I don't see anything else. If folks, because we do have, plenty of time, if you want to pop off mute and ask a question really quickly, very happy to entertain that so that I don't miss your question. And we just had one pop up in the chat. What if you didn't know they were part of the Embold network and you paid a copay? And that's a great question. So if you didn't know that your provider was in the Embold network at your time of visit and you paid the copay, when you get your EOB from Blue Cross Blue Shield, it should tell you, it should show your cost share for that visit. So your EOB for that visit should be a $0 cost share. And if that happens and you did pay the copay to the provider, you can give them a copy of that EOB and ask them to refund the copay that they charged, which they are required to do anyway. Mano, urgent care is not in the search tool. It's not one of the measured, is it?
Correct. So we measure individual providers, not like facility types. So if there is a provider that perform services in an urgent care, you could look for that specific provider, but no, otherwise we're not measuring the quality of a specific urgent care facility. I saw there was a question too on that regular copay for 4/1/25. So just to go back to that, I'm going to borrow your screen, or never mind. You're good here. I won't steal the screen back. But the 4/1/25 changes. So there are flags on certain providers that are no longer going to qualify for the $0 copay as of April 1. So it's not dependent on insurance necessarily. There could be a number of reasons why the provider has that flag. Either they have left the network, or they're no longer practicing, or they no longer meet the $0 copay requirements. So those ones are the ones that are flagged with that regular copay after 4/1/25 badge. And I can pull up an example of that here as well. Here we go, slowly but surely. So if I'm looking for dermatologists, but I want to be sure that I'm seeing someone who, if maybe I need to establish a new relationship now, and I know that my care will carry on into the new plan year. I don't want to pick, for example, Dr. Galfond, because this provider would be required to have that regular copay collected as of April 1. So that's what that flag is calling out there.
Hi, I have a question.
By all means.
Go for it.
Okay. My provider, who is a dermatologist, she was on the list for Embold last year, not realizing she was. And I did get back, I did pay the copays, but they refunded it back to me in the amount of $700, which was a big surprise. So they wanted to know why they're no longer on the list and how can they get back on the list with Embold for the new 2025 enrollment for the coverage.
Yeah, so if individual providers would like information on, why they are rated the way they are rated, they can contact us directly. So within that healthcare provider information dropdown, our contact information is listed there. It's quality@emboldhealth.com, and that is for the provider's office to contact. I'm going to give them a full report on, where they're doing fantastic, areas of opportunity, and they can also schedule conversations live with our provider relations team just to walk them through that report as well. So more than happy to make that connection with your dermatologist so that we can explain that thoroughly for them.
And I'm sorry, where did you find this information? Because I am logged on to the Embold site, and tomorrow I have an appointment with the dermatologist. So I would like to share this information with them tomorrow.
Yeah, so if you click on the healthcare provider information, it's the drop down that I'm sharing currently. That if you just click print, you can, all of the information will automatically expand when you click print. So, they'll have the full detail there. And so it'll have the email address for your provider there, and they can contact us and we can get that scheduled with them.
Awesome. Thank you so much for your assistance.
Of course.
And let's see, there is a question in the chat. Some EOBs are billed as office visits and some are office surgery. Does the $0 copay apply for office surgery also?
So the $0 copay benefit is for the office visit. And then anything else beyond, your visit that is specific to your healthcare needs, that's going to be dependent on the benefits within your specific plan.
And just to speak a little bit about the benefits to the specific plan, if there is generally speaking, and as long as it is coded as such, by the provider if there is a procedure that's performed during an office visit copay, during an office visit, then that procedure would be covered by the copay. So it really depends on how the provider is submitting the claim to the insurance carrier and what codes are being used for that. But generally, services that are performed under the auspices of an office visit are covered by the copay.
I have a question. I have seen a orthopedic knee specialist twice, and so I decided to go for the PRP injection in April. And I just looked up the orthopedic surgeon, and he requires a copay. Well, the two visits I had to his office, I didn't have a copay for. I didn't, but I will have to pay for the injection. But I'm wondering if because it said he requires a copay, does that mean he's not a good doctor?
Not at all. The Embold criteria that's applied to providers is outcome and quality that's measured over time. And it's just a high bar of measurement. So it means that these are the highest performing doctors within the network. It doesn't mean that they are better doctors or that a doctor who doesn't have the Embold copay is not a good doctor. It just means that of the pool of providers that are available, these providers that have that $0 copay from Embold have met a very high standard of outcome, consistent quality, making sure that you get the right care when you need it over time. And Mano, I don't know if you want to add anything to that.
Okay.
Yeah, the only thing I add is, I mean, you all have a very strong network as is, and we don't want to minimize the choices that you have. It's just making sure that you're equipped with as much information as possible to make those choices and decisions.
And I got a
Thank
question
you.
here, and honestly, I'm not sure what the answer is, and this might be something that we take away. But and it's never come up before, when the copay is waived, is Blue Cross Blue Shield paying that copay to the provider, or is that just something that the provider agrees not to be? Well, I would assume Blue Cross would have to pay it, but I'm not sure.
Well, I think I'd met my deductible for the office visits.
Could be. Just a reminder to everyone, because a question came up, what's the advantage for the doctor to be on Embold? The advantage is that they get a larger, more patients would want to see them if their quality designation is higher. If they're designated as a high quality performing, a high performing provider who consistently delivers quality, patients are going to want to see that provider. But the Embold Health designation, it's not a network that is separate and apart from the Blue Cross Blue Shield network. It is the Blue Cross Blue Shield network of providers. And of that network, those providers have been identified as high performing. So you're not seeing a separate network of providers with the Embold Health designation. It's the same network of providers. Just which ones within that network now meet a high level of standard when it comes to quality of care, when it comes to delivering patient outcome. And how far back can you, question just came up, how far back can you request a refund for paid copays that should have been $0? I would submit anything that you have EOBs for as far back as you have them. If you have an EOB that shows you have a $0 copay for a visit, give it to your provider and ask them for a refund of anything that they charged you for that visit. And a question just came up about the copay required by the doctors. It's a copay that's decided at the plan level for the visit. The copay is paid to the providers in addition to anything that they may be contracted for those services. Blue Cross Blue Shield is paying them for their services based on a contracted amount. And hopefully I got everybody's questions. A lot of them coming through. And a question just came through. How do you file a complaint if you feel you did not get the care that you thought you should? If that's specific to the provider not providing the care, we can probably give your HR, your benefits team, some guidance for you to do that. But if it's an issue with the provider directly, it would be a Blue Cross Blue Shield complaint. So if it is an issue with the provider, we can provide some additional guidance there relative to submitting a complaint on the specific provider. And let's see. Did you? Yes, not all specialists. Question just came through in the chat. Did you say that not all specialists are Embold Health designated? That is correct. Not all specialists are designated as Embold Health. New specialties are added all the time, but the best place to check whether or not an Embold Health designation has been applied to the Blue Cross Blue Shield provider is directly in that provider guide. And just really quickly, show you guys the screen again. It's icuba.emboldhealth.com. I'll go ahead and put that in the chat again for everyone. But you can search provider by name, by specialty, by place. You'll see the top searches here, but you can pick any specialty to search for Embold Health designation. I'll grab, let's see, let's find something, neuropathology, no results. So you can search any of the designations that are there to find Embold Health providers that are designated, Embold Health designated providers in the Blue Cross Blue Shield network. And again, the best place to do this is directly on the provider search tool. You can check your providers directly, or you can search for providers in your area. If you see the $0 copay, the blue badge, then you know that they're designated as Embold Health providers. If you see the orange $0 copay required badge, you know that they're not designated by Embold Health, and you would pay the usual and customary copay for that visit. And I think that puts me up to date on the questions. Is there anything else, Mano, you would like to add, or Latrice, do you guys want to share anything additional?
Nothing additional that I can think of, but again, certainly can support any questions that come through after we wrap up. But again, really appreciate your time and the questions that were submitted. I appreciate any and all feedback. We want to make sure that this is the most user-friendly tool for you all and really help you find that top quality care. So appreciate you partnering with us.
Yeah, I will echo that and thank all of you for joining us. If anything does come up, we're happy to, again, we're happy to help in any way that we can. This recording will be shared on our YouTube channel, the IQVIA YouTube channel. It'll be in the web recordings playlist within probably 3 or 4 days, depending on how long it takes to pull everything down and just make sure that it's edited and up there. All right. If there are no additional questions, I will thank you guys, and we'll see you again next month for our next Wellness Matters.
Thank
Thanks
you
for
all.
joining.